We are starting to see climbing cases of COVID right now. At the same time, parents are still waiting for the green light to vaccinate the youngest kids. Here to answer your questions is Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Thank you so much for being with us.
Sure, good to see you.
All right, Dr. Moffitt, no doubt everybody keeping a close eye on that Omicron subvariant known as BA2. We talked about this with you a little bit last week. So as cases have climbed slightly, do we know any more about how this impacts children and what the appropriate level of concern might be for parents?
Yeah, we are seeing some increase in cases over the last week or two, and largely likely due to the BA2 variant, but we're not seeing an explosive rise in cases like we did in late December and throughout January with the original Omicron variant. And what we're learning so far, especially from other parts of the world that are seeing a lot more BA2, is that it is a lot like the original Omicron strain in terms of its severity. And this is holding true in children, where though we saw a very sharp increase in numbers of cases of Omicron in children, we were not seeing increased severity. And in many instances, even it's been shown that the severity from pediatric Omicron infections was less than it was with previous strains such as Delta. So hopefully that holds true.
Yeah, that's good to hear. We also know that federal regulators are looking at a potential vaccination plan for kids 5 and under. We also know Dr. Fauci has made it clear this is not something that's going to be rushed. Is this more focused on efficacy or safety?
Yeah, both will be important, but safety will really be prioritized here. Because children are less likely to get severely ill from COVID-19 than adults are, the bar for safety will be even higher from the pediatric data sets than it was in the adult trials. It will still be important that there is a clear impact on reducing infections at all, but the impact on severe infections will be even more important, but safety will really be prioritized.
So last week we talked a little bit about how pediatricians are seeing an increase in stomach bugs, colds, other viruses now that masks have come off in a lot of schools. So with that jump in seasonal illnesses that are not COVID, what should parents do if their child is sick and those symptoms kind of linger longer than usual? Obviously, you don't want your child to miss any more school than absolutely necessary.
Yeah, no, we are definitely seeing an uptick in non-COVID respiratory infections and colds, as well as stomach bugs, as you mentioned. And this is all overlaid on the beginning of allergy season, which impacts a lot of children too. But it's important to remember that the overwhelming majority of these illnesses can be managed very safely at home with interventions like hydration and fever management. I would encourage parents with any concerns about how long their children's symptoms have gone on to start with a phone call to their pediatrician. And likely this can be addressed through a phone call or by setting up an urgent visit with the pediatrician. I would point out that emergency rooms everywhere are very, very busy right now. And the overwhelming majority of these concerns can safely be addressed by at least starting with a phone call to someone's pediatrician, especially if their child's hydration status and breathing seem okay. So that's generally a good place to start.
That's good advice, Dr. Kristen Moffitt. We always appreciate your insight. Thank you.
Sure, good to see you.
Thank you.